What is up, everybody? Oh my goodness, I'm so excited for another fantastic episode of Eyecare Today. We have a very special guest, not a guest. She is, a cornerstone of the practice, really has become a welcome face to all of you at many locations throughout our servicing area. Dr. Corinne Bellinger, we are so excited that she's here. We've got 3 wonderful locations. Hazleton at 281 Airport Road, Hazel Township, PA. Beautiful, fantastic, gorgeous, state-of-the-art office in Tannersville, right down the street from the outlets. You can't miss it. Go do some shopping. 2942 Route 611 in Tannersville. Can't miss it. You'll love it. And our brand new office in Pottsville, actually they call it Palo Alto. In Pottsville, and just a beautiful office there, state-of-the-art equipment, brand new frames, and of course we've welcomed our newest doctors to the practice, both in Pottsville, Dr. Akirta Saran and Dr. Brendan Connors. So wonderful new doctors to the practice, and we're excited that they have joined us, and you can see all the telephone numbers here for our brand new office in Pottsville, Hazel Township, and of course the Poconos. And so I want to just jump right in because we have a topic today called the top 3 with Dr. B. This is Dr. Bellinger. Dr. Bellinger, first of all, you're a hometown person, right?
I am, yep.
So where are you from exactly?
I am born and raised in the Poconos.
The Poconos. What is the Poconos?
The Poconos
Everybody
is
knows.
Miles and miles long.
What is it? Everybody says the Poconos, and I think it's expanding. Is it getting bigger?
Very much so expanding.
Yeah.
Yes. I originally grew up in Long Pond.
That's the Poconos.
That is
the real Poconos. There's no debating.
Right near the Pocono Raceway.
I didn't know that about
Yes.
you. Okay. Are you a fan of the raceway or?
I think it's they host great organizations and things. I never followed NASCAR.
All right.
But we always got a kick out of the traffic coming in and out of the raceway.
Big event.
But then probably when I was 10, we moved down more towards Tannersville.
Okay, wonderful. So Tannersville, Long Pond, very much a big part of the Poconos, and your family has been involved in the Pocono region for quite some time. Mm-hmm. I believe your dad has been building houses and things like that for many, many years. So an integral part of the community in the Poconos, and back to serve the people whom I think probably you and your family have been in touch with for many years. So it's very exciting. When we talk to people in the office, one of the things that happens all the time is that we, are talking to patients, and, we ask them about their family history. We say, did your Aunt Susie or your Uncle Harry ever have any eye conditions? And very often they say, yes. What is the most common thing people remember or hear? Oh yeah, they had this, when maybe it was something else, but they think that they had something. What do you hear?
Probably cataracts.
Cataracts,
yeah,
100%.
Number one.
Not Lincoln's.
Nope.
Cataracts, that's my number one joke. Cataracts. So let's talk a little bit about cataracts, because this is, again, the top 3 with Dr. B. So number 1 is going to be cataracts. The top 3, number 1, cataracts. Easy. So what is your spiel with patients as far as, hey, got a cataract, or you find a cataract, they're worried about it. How do you explain that to a patient?
I think the most important thing is that I think there's a misconception that a lot of people think that it's a disease process, and a cataract is something that is built up over time it's protecting your eyes over time from UV damage. So everybody.
I didn't know that, actually.
Everybody.
I love that. Is that what you say that? So it's like an evolutionary trait almost, that our eyes are...
Well, our lens sits behind our pupil to protect the retina
right.
from UV damage. So being exposed to UV light in our lens over time is going to create some colorations and distortions and things like that.
See that? This is a good thing. I'm learning something today.
So I always remind people that it's not necessarily it's not a disease process, and it's not something that we can't fix or treat or help. There are different types of cataracts, which obviously is a different scenario that can come along with other diseases, but it's still something that we are able to treat.
Cataracts don't hurt, and
do not hurt.
That's something, right? Though people they hear something, you think there's something wrong, it must hurt. It must be something that I feel or that I can notice. And sometimes people will say, yeah, you know what, after you say, hey, this is what's going on, we have this clouding of your lens, and this is what we think can happen as a result of it. Oh yeah, I feel something right here. They automatically think that this is some Can you feel a cataract?
You cannot feel a cataract, no.
How do you describe that? I think that's a very hard thing to describe.
Well, and it is difficult in that people often assume that they're going to notice there's a cataract. But because it is a process that's happening over many, many, many years, you don't necessarily notice that your lens is getting distorted or cloudy or blurry because it's what you know. It's what you're used to. So that's why, it's very important, even if you don't need new glasses or anything, we always check your eyes, once a year at least, because then we can be on top of following the cataract and getting to it before it becomes a problem for you.
Gotcha. So let's talk about when it becomes a problem for you. What is something do you think the number one thing people will see or experience when they start to have a cataract? What could they be looking out for?
Most people that do notice symptoms or do get something from a cataract or visually are able to identify it would be glare at night.
Glare at night.
And that's becoming increasingly more common to talk about.
It's those headlights.
It's the headlights.
That's what people, those darn headlights, those bright headlights that they say.
Yep. So the cataracts are going to make them much more glary and haloed, and really a lot of people say, I just stopped driving at night, and that's not the solution. I tell people, that's, thank you for being mindful that you feel like
all the nuts are out. I get
it. That you can't, but you shouldn't have to feel as if you can't leave your house just at night because of your visual symptoms.
Right.
So then that's when we really start talking about, getting it treated.
But don't they need to be ripe? That's what a lot of people say. And listen, you're not wrong. If you were told you have to wait till they're ripe, you weren't wrong. You just weren't probably fully educated on what that really means. And so that's not something I love to hear. I don't love this ripe word just because I don't think it's not scientific. It's not a measurement. We really try to go that extra mile to make some measurements. But also listen, just like you're saying, when patients' lives are affected, they can't go out. That right there is that tells me all I need to know, really. But tell me about this ripe idea. What do you think about that?
Well, I think that, there's a certain degree of cataract that can really start to affect your visual acuity and your vision. Typically, we want to treat it before it's becoming, affecting your quality of life. And I think that in today's, day and age, our visual demands are so much greater than they used to be. So we are relying on our eyes and our vision for so much more than we used to. We used to just listen to the radio or just listen to the TV. Now it's like we're watching everything. So, it's ripe is in when is it affecting you and your life.
Right.
So.
And I think if there's a question, the bottom line is if there's a question, if you feel like your nighttime vision is being affected, you're having issues with glare, you just can't see the way you can't see your TikTok videos the way you once did, then you need to give us a call and get an appointment with Dr. Bellinger, because she will tell you whether you're ready to get those cataracts out. So on the next segment, when we come back, we're gonna go number 2 with top 3 from Dr. B. See you soon. All right, everybody, we are back. So excited. We have the top 3 with Dr. B, Dr. Corinne Bellinger here, a native of the Pocono area, is in our Hazleton office quite often, as well as the Tannersville office. Basically all the time. You live there, if I'm not mistaken, right? So if you need her, she's there. and is taking new patients, and certainly would love to welcome you and your entire family to our Hazleton, Stroudsburg, and Pottsville eye specialist family. And furthermore, we'd like to tell you about all of our locations. We're located 281 Airport Road, Hazel Township, PA. Give us a call, 570-453-2020. We are located in the greater Stroudsburg or Pocono area in Tannersville. We have an identity crisis there. We call ourselves Stroudsburg Eye Specialists. The backstory is we were actually in Stroudsburg and we relocated because we needed a larger footprint. So we're happily located in Tannersville, right behind the Friendlies off of Route 611 in Tannersville. Give us a call at this phone number at our Tannersville location, our brand new location in Palo Alto, Pottsville Eye Specialists. We are so excited to be opening our doors to the Schuylkill County area, and very exciting thing, and that is that we are going to have a retina specialist on staff in the Pottsville location starting in the summer of 2022. Very excited to have Dr. Sachin Patel joining us in our brand new specialty suite. It is going to be completed, ready, welcoming you and your family and your loved ones who have macular degeneration and diabetic retinal disease. If you're getting injections in the Schuylkill County area and you'd like to check us out, give us a call. We'd be happy to accept you into our Pottsville Eye Specialist family. So, the top three with Dr. B. Number one was Cataracts, not Lincolns.
Not
I love
Lincoln.
it.
Cataracts.
So if you're experiencing nighttime glare, halos, blurred vision, you're just not sure why that is, and time is going on, come check us out, and we'll let you know if there's some cataracts there, and easy fix. Number two. What's number two? What do you think?
I would say glaucoma.
So let's hear it. What's your elevator pitch for glaucoma?
So glaucoma is a tough disease because there's no yes or no answer to glaucoma. It's not as...
There's no blood test.
There's no blood test. There's no, your blood pressure's elevated. There's many factors that we have to look into in order to make that diagnosis. Yeah. So it becomes, it becomes something that, patients...
It's challenging.
It's very challenging.
It's challenging to describe. I think for us, it's challenging for patients to understand. But probably two things. I think two things are sort of I don't want to say well understood, but thought of when it comes to glaucoma. I think one is pressure.
Pressure, yep.
Right? My pressures. Mm-hmm. Did you do my glaucoma test? Which is the pressure test, right? So let's talk about pressure. So go ahead. What's your spiel on pressure?
We have a globe, which is our eye, and within that globe
like a snow globe.
Exactly.
I'm just kidding.
Within that is a pressure, which maintains its integrity of the globe. So we are able to check that pressure. There's things that can obviously affect that pressure, different thicknesses of tissues and such like that. However, we use that as a grading scale of, is that number going to be too high or too much pressure for your optic nerve to sustain over time?
How much is too much? I know this is, and it's a loaded question. There really is no right answer. Okay, but.
So we get more suspicious of glaucoma, or maybe we run further tests when your pressure gets a little elevated, usually above 21-ish.
I like that. Yeah, sure.
That's when we kind of, maybe we check you more closely. You just become more of a glaucoma suspect.
Yeah, and all of our eyeballs are kind of similar, and so there were some big studies done many years ago that looked at average eye pressures, big population studies that looked at big groups of people, and they came up with an average of 16, and that's where this number comes from. And they said, well, we go a little bit higher, a little bit lower, and that's where we end up with this number of 21. So I think it's a good number to be at, but there's more to it than that.
There's a lot more to it, yeah. And you can have pressures that are 22 23 your whole life, and your optic nerve is perfectly content under that pressure.
So you just said something really important, optic nerve. So tell me a little bit more about that. What is...
So the optic nerve is the structure that takes all of the retina ganglion cells from the information from what you see, and it travels all the way to the back of your brain, to the visual cortex. Wow. So the brain interprets what we see. The eye collects the data. So the optic nerve is that structure. And so it's a very important structure, obviously, for, you know, the integrity of our sight. As a glaucoma suspect, or anybody that could be a suspect of glaucoma, we particularly watch the optic nerve, because that is the structure within the back of the eye that is going to be damaged if you have glaucoma.
So let's talk about some of the things that we have at Hazleton, Pottsville, and Stroudsburg Eye Specialists that sort of differentiate us in being able to assess the optic nerve, this very important tissue that ultimately is going to be what's telling us whether you have glaucoma or not, or have a suspicion of glaucoma. What are some of those technologies that we have?
We use an optic nerve OCT machine, which is able to measure the thickness of those nerve layers, and that can give us information on, is your nerve a nice healthy nerve? Do you have enough of those tissues to sustain your vision for life?
And these technologies, I think, you know, fortunately or unfortunately, a lot of folks that come into the office take these things for granted because we've had them for quite some time, and we really do invest heavily in the technology, the practice. But in some locations, these technologies are only found in large hospitals. So I think it's really a wonderful thing that we're able to offer that. So we measure the optic nerve, we measure the pressure, and the outcome of glaucoma is what? What happens to a patient if they're experiencing true glaucoma?
True glaucoma is going to rob your peripheral vision from sight. So it starts with your peripheral vision, and it can kind of come down to your central vision. You know, in the very advanced stages, you can completely lose your vision from glaucoma. The biggest thing is checking your peripheral vision, because that's where it would start. So that's when the visual field test comes in, and that we do here in office, and everyone loves.
That's everyone's favorite test.
Everyone loves to hate it.
You love it.
I love it. Yes. It's great.
No one enjoys anything more. It's better than Knoebels. It's better than Dorney Park. Sitting in a dark room with your head in a white bowl with a clicker. Click, click, click. That's the visual field test. It's a blast.
It is a blast.
But it's very important, and it gives us the information we need to determine whether or not there's been damage done to your eye. So very important. If you or a loved one in your family, probably more so a loved one in your family, has ever been told that they have glaucoma or they're being treated for glaucoma, typically what that looks like is an eye drop. Probably 70% of people that have a diagnosis of glaucoma have been using an eye drop of some type to lower their eye pressure. So if you or a loved one has ever been told that you have glaucoma or risk for glaucoma, please make a call and allow us to give you the best, most up-to-date, most advanced information as it relates to glaucoma suspicion, or whether or not we could do any better in reducing the likelihood that you are going to lose vision. So Dr. Bellinger is accepting new patients to be able to assess glaucoma, treat glaucoma, and monitor glaucoma. We are so excited. The top 3 with Dr. B, cataracts and glaucoma, and we got one more to go, so don't go away. We'll be right back. Hey everybody, welcome back. We're in our last segment of the top 3 with Dr. B. Dr. Corinne Bellinger has become a cornerstone to the practice. Give us a call at our Hazleton location or Stroudsburg location to see Dr. Corinne Bellinger, a new mom as well, and very exciting, you know, building a family in the Pocono region, and been part of the Pocono region, her and her family, for her entire life, and just an integral part of the community, giving back in many ways too, which I think is important. So do you mind just telling us a little bit about some of the things? I think you're pretty involved with a couple different things in the Pocono region. What are some of the things you've been doing?
So I've been a member of the Tannersville Lions Club, so obviously the philanthropy is preserving vision, saving vision, helping people with vision. So that's a big thing. We, as our practice, I am the provider that is the referral site for any child that fails a nurse's exam at Pocono Mountain and does not have the funds to be getting glasses. So the family is able to work with the nurse, and we end up seeing them at the office. And third, these used to be the Center for Vision Loss, and now is Hope for Sights, based in the Saylorsburg office. And we work with them, and we work with their kid screening programs and their low vision programs. And so, yeah, we're doing
She's
a
doing a
lot.
lot. She's doing a lot. So, sometimes patients will say to me, Doc, thank you so much. You did a great job. I really had a wonderful time here. Thank you for everything you did. And honestly, I don't care. We don't care where you get your glasses, where you get your contact lenses from. We don't. We want to give you the best care possible. We want to provide you the best vision possible, and we want to make sure your eyes are healthy. But I think one important thing to know is that we try to go the extra mile to be part of the community. We try to integrate ourselves into the community. We support the community. This is just one example of many things that we do in the regions that we serve. And so when you support us, by getting your optical correction, whether it be frames, lenses, contact lenses, with us, that's what you're supporting. To be very honest, with our time and our resources here, and supporting our staff as well in the community.
If you or a child within your family or anybody you know is having trouble purchasing glasses or any of that matters, you can always reach out to your local Lions Club. Our particular Lions Club in Tannersville would be the Tannersville Lions Club, and they work one-on-one with our office to provide that care. So we're able to get your glasses and things covered.
It's fantastic. It's absolutely fantastic. So the top 3 with Dr. B, here we are. We covered cataracts, not Lincoln's, and glaucoma, the silent thief of sight, because it could come in from the side and steal your peripheral vision away. So big important thing there is, if you're having trouble with nighttime vision, get in, let us check and see if there's cataracts involved. 2, just kidding, cataracts. 2, if you or a family member has ever heard the word glaucoma in reference to you or anyone that you're related to, you should really get your butt in here and allow us to make sure that that is not in fact happening to you, because it is painless and it can happen without you knowing it. So number 3, Dr. B, what is it?
Presbyopia.
Whoa! You shocked me with that one. That is a good one, though. That is a really good one. The most common condition, period, that affects people's vision on a global scale is presbyopia, literally billions of people. So tell me about this. This is a good one. How do you describe that?
So presbyopia is something that will happen to everybody. It usually hits within your 40s, and we lose the ability to fully use our focusing muscle within our eye. So that muscle just wears out over time, and we can no longer see up close.
Oh my goodness.
And that is where our world is.
Moving things away. I tell people, you just need to make your arms longer. Forget your eyes, we'll just make your arms longer. Yes, this is a big one, and it could really be scary, and could cause some anxiety, some stress. So you described what happens. Now, what's the solution?
There's many solutions. Obviously, the top one people choose is glasses, right? Come in, and I always say that presbyopia is God's gift to getting you in the office.
There you go.
Right?
Thank you, God.
Because otherwise, who knows how long you would have gone without ever having your eyes checked.
That's right. Yeah,
so when you come in with this complaint, we obviously are going to do a comprehensive eye exam where we check you for cataracts, glaucoma, macular degeneration, freckles in the eye, and things like that. So glasses is number 1.
You know, I always, you mentioned getting people in the eye. I have a quick story of a patient that called me. So we take emergency calls. So if anybody ever has any eye worries in any one of our 3 locations, call us. We're available 24/7. Dr. B takes all those calls. So she's happy to help you. I'm just kidding. But I had a patient call me 8 o'clock Saturday night. Doc, I can't see. And I said, what are you talking about you can't see? And they said, I can't see. And I said, well, I want you to go into your kitchen, and if you can you walk to your kitchen, cover one eye, look at the clock, because it's a standardized size, so I could know kind of how they're seeing. Had them stand 5 feet away, look at the clock. They said it's 7:30, 8 o'clock. And I said, yup, you're right, it's 8 o'clock on a Saturday night. Then I had them cover their other eye and look at the clock, and they could see it. And I said, what are you talking about you can't see? And they were very worried. And they said, I looked at an email that I saw this morning, and now I can't see it. Sure enough, it was the presbyopia. That's what it was. And I worked through a couple other things, but it can be like a scary thing. Absolutely. So glasses, that's number 1. What's number 2? What else can you do?
We can attempt to fit multifocal contact lenses. Yeah. And now the newest thing would be that everybody's coming in asking about, would be the newest, first FDA approved drop treatment for presbyopia, and that would be the Vuity drop.
And I think one thing that I'll just add about the drop is, if you think about drops and you say to yourself, well, gee, I wonder, are drops going to be something that, you know, is good for me or not good for me? Should I get this? Should I not get, you know, I don't know, I'm not sure. I'll just tell you, there's 5 more drops in the pipeline under clinical trials right now. This is going to be something that you're going to continue to hear about. So we're really excited to offer it. We're excited to be very comfortable on how to, you know, make sure that it's something that could be something that works for you. And many patients will find that it can help in certain scenarios, but not in all of them. And so I think the bottom line is, if you're experiencing blurry near vision, it's time to come in for an eye exam. Like Dr. Bellinger said, this is God's gift to get your butt in our chairs and make sure that you don't have
glaucoma, cataracts, and freckles in the eye.
Freckles in the eye, or macular degeneration, or signs of diabetes. There are literally hundreds of things that we can see inside your eye and that you have no idea are there. And beautiful thing is, we have a wonderful array of technologies that not only can we see it, but you can see it too. And I think it just makes it that much more real. So Dr. Bellinger, thank you so much for joining us on the show today. I just cannot say more about the care that Dr. Bellinger gives to her patients. Truthfully, being part of the Pocono family in that area, having her family in that area, I see the way she treats her patients, and it's like she treats every single patient like they're part of her family. So we are absolutely blessed to have her be part of our office, and I just want to make sure you all know her and are comfortable, reaching out under any circumstances. So Dr. Bellinger, you're the best. Thank you so much for joining us.
Thank you.
We need to do the top 3 with Dr. B like monthly. I think we just, that's done. Anyway, so thank you all. We're really excited to see you in one of our offices. We'll see you real soon.